For the first aid section of the NIPPER exam, there are 13 rules in total. For the under 9 and under 10 age category, that is the level 1 of the exam, you have to learn the first 5 rules of the first aid section. The first rule in first aid is sun sense. Not only is sunburn very painful if you get burnt badly, sunburn also can lead to heat exhaustion and sunstroke. You want to slip on a shirt, you want to slop on some sunscreen, and you want to slap on a hat.
Slip, slop, slap. Slip on a shirt. Slop on sunscreen. Slap on a hat.
Remember, sun sense. Blue bottle stings. Blue bottles can be found all along the coast of South Africa. It's a little blue animal floating on the surface of the water, and it's got a long tentacle, and if the tentacle wraps around your arm or your leg or touches any part of your body, it stings. The first thing is you do not want to rub it with sand. What you want to do is those tentacles sometimes get stuck onto your skin. You gently want to use some seawater to wash it off, or pick it off with your fingers and just pull off the sting from your arm, and you can put some ice on there to take the pain away. And then you want to go to the lifeguards, or if it gets really bad, you want to seek some medical advice. Cramps. The most common causes of cramp are if you're doing too much exercise of unfit muscles, and what happens is your muscles contract into a ball, and it can be very, very sore, and sometimes you can't move your arm or your leg or whatever part of your body is cramping. So if you get a cramp in the water, the first thing that you want to do is you want to try and relax and float on your back, and then just try and signal for some help. Don't panic, and try and stretch the muscle out. If there's no one there to help you, you want to try and safely, gently just float back to shore, to the side of the pool, without using the muscles that are cramping. And then when you get out the water, try and keep that muscle warm, and you can gently massage that cramp out. Sand in the eyes. If you go to the beach, very common for you to get sand in your eyes. It's important when you get sand in your eyes, you don't want to rub the eye with the sand in it. You want to try and use some water to wash it out, or you can use a damp cloth to rub it out. You can also take your eyelid and pull your eyelid over the eye, and as you blink your eye inside, it'll move the sand out to the side. Bleeding. When you're helping somebody who's bleeding, very important, before you start helping them, put some gloves on so that you keep the blood off your hands. So if you are treating minor cuts, obviously you want to stop any activity that you're doing. You're not going to carry on playing beach cricket while you've got a cut on your hand. You want to place a pressure on the bleeding part with your fingers or with a bandage. If you can, try and pick up the part of the body which is bleeding, like the leg or the arm. You want to try and clean around the wound with some disinfectant. Put a dressing or a bandage on that while keeping pressure on that wound. And if the bleeding doesn't stop, if it's getting serious, if it's serious bleeding, then you need to go and get some medical help.
Nose bleeding. If you should get a bleeding nose, sit down, put your head forward and pinch the soft part of your nose for about 5 minutes and breathe through your mouth. Don't tilt your head back, and also remember not to blow or sniff through your nose.